Well, what is cannabis? Cannabis is not any of these things, though. Okay, it's not a panacea. It's not. It doesn't actually cure anything. It interacts with a body system that has a lot of therapeutic potential, but it does not actually cure any particular disease. It can influence that body system to have some really powerful, even potentially curative effects, but it itself is not doing the thing. It is not dangerous. It does not cause any physiological organ damage except the inhaling of smoke, but that has nothing to do with the drug. That's inhaling smoke, and there's other ways to intake the drug. It's not part of the spread of STDs. It's not the cause of criminal behavior, except where it's illegal, so by definition. It's not physically addictive in the way that we typically think about drugs being physically addictive. That is not to say people don't feel physically uncomfortable when they stop using cannabis, but it doesn't produce physiological withdrawal of any medical concern. And that's for the vast majority of people. I'm sure there are exceptions. It is not non-habit forming, though, so people do definitely use it habitually and do become dependent on it. It's not a gateway drug, though. This has been looked at many times. People who start using cannabis don't overwhelmingly go on to use harder drugs. It's just not how it works. Okay, here's an interesting question. What are safe distinctions for the synthetic strains of THC? How does a client safely acquire cannabis for anxiety, pain-related stress? So first of all, any synthetic cannabinoids, one should advise clients to stay away from. The only way to safely access cannabis for medical purposes is to go through the state's medical cannabis program and go through a licensed dispensary. So that's the advice that you should be giving your clients to access cannabis for their medical concerns. And then depending on the conditions allowed in their state, the chronic pain is pretty much allowed in every state now. But anxiety or psychological conditions aren't in every state. Well, what is cannabis then? It is misunderstood, as we've already seen, right? In the questions and in some of the things I've said today, there's a wide ranging understanding of what cannabis does or doesn't do, or a vast gap in knowledge in general, which is why I have this job. More THC. It's a lot more than THC. Lots and dozens and dozens of cannabinoids have been isolated. It's one of the most widely cultivated and valuable plants on earth. It's very intentionally planted, so it's actually not even a weed, right? So the definition of a weed is a plant growing where it's not supposed to. That's not happening very often with cannabis. It's generally very intentionally planted. Illegality has at times negatively associated with crime and other drug abuse. Although it is generally not the cause of those things, but it can be associated. Increasingly, it is used now due to reducing prohibition and acknowledging therapeutic uses, and the widest growing demographic is adults over 50. It is not young people. There has been a slight uptick in school age use, late in high school and college use. But there's also been a decrease in alcohol use. There's also an increase in self-report as well. So it's really hard to know what these numbers mean, because people if it's not a crime, people are much more willing to say it. There's less stigma attached to it. One of the factors there, I reviewed a study that came out recently talking about long-term cannabis use, but the data is from the 1990s. I feel like I can't trust that, because people's motivation then for using cannabis, totally different now. The type of person that would choose to or be motivated enough to use cannabis, totally different now. One that chooses to use it for medical purposes over time is going to use it very differently otherwise. So that data is not trustable because it's 33 years old. But the public study was just published using that data last year. It's kind of silly, and that's a really good illustration of how difficult the knowledge base in academic research is with cannabis. You have to be very careful to look at beyond the conclusions, how is the study constructed? What were the dosages that the animals or people were given? And how old is the data? My clients report daily marijuana use increases their anxiety. Does research support this? Yes, sort of it does. And that's that THC to CBD ratio that I'm talking about. If you tell your client that research shows that people who use a form of cannabis that's equal to or higher in CBD have a much higher threshold of dosage before reaching uncomfortable effects. And we'll go over that later.